Well, good morning, Miss Daisy. So the record says here that you're here today because you've had some rapid weight gain over the last few months. Tell me, what's been going on?
Yeah, so my husband and I worked from home during COVID, and we both just noticed that I was gaining a lot of extra weight pretty quickly. So he thought that I should come in and get checked out.
Okay, well that is concerning. Well, let's go ahead and do a full exam. Why don't we take off your coat?
Okay.
What the health? Hi there, I'm Janelle Thompson, the nurse practitioner at the Hawkeye Student Health Clinic, and on today's episode of What the Health, we're going to be talking about contraception options that are hormonal that we offer here at the Hawkeye Student Health Center. I will start off with a disclosure that none of these will prevent you from getting a sexually transmitted infection. So the only way that that can be prevented is do not have sex, or make sure that you're using a barrier method such as a male or female condom, and that doesn't completely guarantee that you won't, but that is something that can help prevent that. I'm going to start off with showing you a diagram of the female reproductive system, as we'll use this as we talk about the options that we offer here for contraception for females. With this anatomical model, we have the female ovaries, the fallopian tubes, the uterus, the cervix, and the vagina. For pregnancy to occur, an egg has to be released from the ovary, travel into the fallopian tube, and that can happen from either side. At some point, sperm needs to meet that egg. The egg comes down, it has to transplant into the endometrial lining in the uterus, and that's where pregnancy can start. And so with hormonal contraception for women, the prevention of the ovulation, the egg coming into the fallopian tube, the egg being released at all, is one method. Another method is interrupting the lining called the endometrium, where the egg would implant if it was fertilized. Also, at the opening of the cervix, mucus is made, and contraception methods can increase the thickness of that mucus so that semen, sperm, can't penetrate that as easily and even work its way up to the egg. So if you would come into the Student Health Clinic and have interest in starting a method of contraception, we offer several of them here. We also offer counseling for other types of contraception that aren't offered here and can make referrals to a women's clinic so that you can have that further discussion and have those options. So we do give you information about those as well, starting with something like the birth control pill. So if you're somebody who can't remember to take a pill every day and pretty much take it at about the same time, it's probably not a good selection for you. And it does offer just a consistent amount of hormone routinely, and most commonly then there's a 7-day time frame where there's either vitamins in it or really not any active ingredient, and during that time a person would generally have their period. Very effective if they're taken correctly. If they're missed, then need to use a backup type, like a condom, or avoid intercourse altogether. Next option that's offered here at the Student Health Clinic is a prescription for the NuvaRing. So the NuvaRing, it's about the size of a ponytail elastic band, and it has hormone implanted right in the ring. You get one pack for every 4 weeks. You actually fold it together and you place it up just in the vagina, and it just stays in there. And with the NuvaRing then, hormone is excreted from the ring. It goes through the vagina, transmucosal, and it's absorbed into the system, and it's secreting hormone for those 3 weeks, just like you were taking a pill. Similar to that would be a patch. The patch is something that we really don't prescribe that often. It's a little bit more finicky, I guess I would say. It is applied just to the skin in a dry area and left there for 3 weeks, and then it's taken off after 3 weeks and a new one is applied. There are occasions where by the third week that the medicine might be wearing out a little bit, especially if it has been exposed to direct sunlight for a period of time, and so it can be a little bit less effective. And then the last option that we offer here at the Student Health Clinic is the Depo-Provera injection. And this is a shot that's given, and it's only given every 3 months. And so this is pretty slick because you only have to remember every 3 months to go to a pharmacy and pick up the vial of the medicine, bring it to us at the Student Health Clinic, and we will administer the shot here. Usually after getting the first injection, about half of the women won't even have a period over the next 3 months, and after you've had 3 injections, usually you won't have a period at all. Women tend to gain 5 or 6 pounds during the first 2 years that they're on the Depo injection. And so for gals who have a concern about that, that can be bothersome. This is also a medicine that if people don't like a shot, that bothers them too. But here at the Student Health Clinic, we have a pain relieving spray that we just put on before we give the shot, and that seems to help people plenty. It has a lower risk of blood clot, DVT, than forms that have estrogen in it, and this is one that we can use in people who smoke, so that's a good thing there. So thank you for joining me for another episode of What the Health, and if you are interested in talking about options for contraception management that we have available here at the Student Health Clinic, please call and make an appointment. I also would like you to let me know if there are any other topics that you would like to have talked about here. We are really enjoying the topics that you've brought forth, and we'll see you next time at What the Health.